2020 recalls questions around 80 questions we will be covering. Let's see. A child is found to have cleft palate posterior to the incisive fossa. This is caused by failure of fusion of. So cleft lip and cleft palate. Questions are whenever cleft lip is there is the medial nasal process and maxillary process is the answer. But now this has come as cleft palate. This is the palate, cleft palate. So it is not intermaxillary, it is palatine. So palate is there, just go for the palatine shelves. Cleft lip and cleft are congenital abdominal gaps. Cleft lip occurs due to defect in medial nasal process and maxillary. This is one question. Cleft palate is due to failure of fusion of palatal processes of maxilla. This is palatal processes. Now, a 45-year-old woman presents with 3-month history of diarrhea and blood mucus. She has not traveled outside the UK. On examination, she is found to be colonoscopy shows inflammation. Biopsy shows acute chronic inflammation with non-caseating. So, non-caseating granulomas with most likely diagnosis. So, granulomas means ulcerative colitis. A baby shortly after birth is dyspneic. Immediately after birth, dyspneic sinus, chest X-ray, multiple gas failure. This is pleuroperitoneal membrane herniation, congenital diaphragmatic hernia. 80-year man is having orthopedic flexion of hip, fixation of hip fractures. He received 28% oxygen. Blood gas shows increased pH is there. pH is decreased. This is acidity. pH is very low means it is acidic. PCO2 has gone high. PO2 is going normal. This is PO2 normal. So this is retention of. This is supposed to be a. If suppose he is now morphine, she is getting sensitive which of the receptor. Blood gas sensitivity is reduced because sensitive to increased CO2 is not responding and patient is not able to manage. Therefore, central receptors are not working. So this is the concern difference between male and female pelvis. Which one of the following statement is most accurate? The female pelvis male. The ischial spine point towards the inward in female. Ischial spine points inward in female. This is not true. This has to be widened. Ischial tuberosity is more prominent in female. Again, it is. Pelvic canal is a funnel shaped in female. Pelvic inlet is heart shaped in female. It is wide. It has to be wide. Pubic arch forms the wide triangle. So what is there in difference? General structure, thick, that is okay. Greater pelvis major is deep. In males it is deep. How is the outlet is comparatively small in males and large in females. Pubic arch is narrow in males and wide in here. Obture forma acetylum. So this ischial tuberosity prominent. It is nothing like that. Pelvic canal is funnel shaped in female. So this is funnel shaped. Its heart is to be heart shaped in male and oval shaped, rounded in female. That is there. 20 years old British backpacker returns to UK from Egypt. 2 months later, he presents to his general practitioner complaining hematuria and terminal dysuria. Which of the following? This age is just 20 years. Hematuria and terminal dysuria. Which of the following most likely causative organisms? So most common is E. coli has to be there, but let's see. Pre-patent period is 10 to 11 egg deposition extrusion. Schistosoma mansoni causes of urinary system. So this is schistosoma. 25 male is involved in the road traffic collision. CT performed shows large intracranial hematoma on the left side of the brain. Which of the following are most likely to suggest that he has developed significant increase in intracranial pressure? Now there is hematoma performed shows intracranial. This is inside. So it is going to erase the intracranial pressure. Which nerve is going to compress? Third nerve or sixth nerve? Let us see what is. So any compression. This is the triad is there. Increase in blood pressure, decrease in heart rate, decrease in respiratory rate. So BP has to increase and so heart rate is decreased, BP is increased. That is Cushing's triad. So signs often indicate Cushing triad. Blood pressure is increased. Okay, and respiration and pulse goes down. Symptoms of increase in opposite. This is opposite of shock. In shock, there is blood pressure is less, pulse and tachycardia. It should be confused with Cushing syndrome. It is state resulting from elevated blood cortisol level. Cushing's triad is different. 65-year-old man with a history of transient ischemic attacks due to which one of the following to internal carotid? Internal carotid begins at C3 vertebra, its ophthalmic branch. So here is the internal carotid, it gives ophthalmic branch, then inside it goes into anterior cerebral, middle cerebral artery. 9-year-old female made a good clinical progress 3 months following diabetic perforation treatment with sigmoid colectomy. Primary anastomosis, a defunctioning stoma is done. Integrity of anastomosis. 64-year woman has made a good clinical progress 3 months following diabetic perforation treated with sigmoid colectomy. Primary anastomosis defunctioning. Integrity of the anastomosis is to be determined prior to stoma reversal. Most operating imaging modality. Colectomy is done, and this you want to go for reversal. What you will do? Water soluble contrast to check the anastomotic leak. Defunctioning stoma. It is now anastomosis done to integrity, leakage is there or what they are checking. 25-year-old woman present to emergency department with the history of headache, photophobia, neck stiffness, lumbar puncture. Perform catheter and syringe contaminates the sample. From where is the blood sample likely to have come? So whenever you are trying to LV puncture, it has to be vena vertebral plexus. Epidural space. This is just like this. Vertebral canal contains vertebral meninges. Which of the following respiratory tests would predict adverse morbidity and mortality after surgery? So, which test of respiration will prove force vital force ratio of FE1 to FEVC less than 90? So, in 90% if it is going out, so FE1 3 liter inspirating capacity points, normal residual volume and total lung capacity. So, force vital volume in first second. Force expiratory volume in first second, FE1. Which respiratory force, one of the force vital capacity is best prediction for morbidity and mortality after surgery? So this is a similar question. It is the ratio of FEV1 to FEVC. If it is less than 70, it will be very critical. A surgeon is mobilizing a stomach for esophageal gastrostomy. Significant bleeding is encountered requiring splenic repair. Which one of the following structure will be divided to mobilize the spleen from posterior? Renal ligament, renal ligament. 52-year-old woman presents to her general practitioner with enlarged thyroid gland and 4-month history of feeling tired. Present general practitioner with enlarged thyroid gland, 4-month history of feeling tired. Enlarged thyroid is there. Hypothyroidism. What is there? TSH is raised and T3 is also raised. TSH is raised, T3 is raised. Following likely. It has to be subclinical hypothyroidism. 28-year-old man is referred with rectal bleeding. He is positive. He has positive family history of colon cancer, multiple polyps in colonoscopy, polyposis, which of following mutation is associated. So, FAP, familial adenosis polyposis, APC gene has to be there, or gene mutation. Let us see, APC is there. Normal epithelia, APC is called dysplasia, KRAS, P53, MMR genes. 40-year-old man presents to his doctor with swelling in the neck of 8 weeks duration. Clinical examination demonstrated that he has multiple swellings in the neck, in axilla, inguinal lymph nodes. So it is Hodgkin's lymphoma or non-Hodgkin lymphoma is there. So it is NHL. 35-year-old diabetic is admitted to surgical with the features of acute appendicitis, not eaten for 12 hours. Glucose is 19, managed by using variable rate insulin. Which one of the following physiological action reflects physiological action? So increased glycogen synthesis in muscle cells is the physiological. It causes deposition. So how is that? Insulin causes adipose tissue to increase glucose metabolism, glycogen synthesis, and muscles increase metabolism. 64-year complaints of crusted ulcerated lesion below left eye of the 6 month duration. Ulcerated lesion is there, left eye of 6 month duration. On examination, lesion has rolled edges with telangiectasia is basal cell carcinoma. Basal cell telangiectasia and rolled edges. This is basal cell carcinoma, typical. Injection of subcutaneous lidocaine when existing an epidermal cyst, scalp produces local anesthesia because it inhibits sodium pump, sodium channel. That is the basic thing. Sodium is inhibited to go inside, so receptors cannot activate action potential. 75-year-old man present with 3 by 4 centimeter right groin, that is non-tender cuff impulse present, opening direct found, hernia sacra is medial to which of the following? This is infraepigastric vessels, and indirect is the sac is from the this lateral. 52-year man working in plastic polymer, previous venal fluid exposure, tumor in the upper abdomen. The tumor which would likely linked with the occupation is bladder malignancy, angiosarcoma of the liver. Okay, upper abdominal, liver is there. There is no bladder inside, so liver angiosarcoma. 25-year man have HIV infection with server. 25-year HIV positive, purple plaques, Kaposi's sarcoma naam, biopsy, which virus associated with Kaposi? This whether it is Epstein-Barr, human EB or CMV, human papilloma, human herpes virus. EB is not there, CMV on the human herpes virus. So Epstein-Barr virus, Burkitt lymphoma, Hodgkin lymphoma, human papilloma virus, and all this. Human herpes virus is for the Kaposi's, HHV KS. This is HHV KS, and HPV is for the a 60-year-old woman presents with hematemesis and found to have esophageal varices. Most likely, her problem is most likely due to increased pressure in portal vein has to be there. So left gastric vein is the branch of that. So here you can see this is the branch left, and this is the systemic circulation. This is the portal circulation. This is the branch of portal vein. "50-year-old woman man presents to dentist with sensitivity of right pain in the right teeth. Exam shows swelling in the right cheek and maxillary sinus infection is diagnosed. Sinus is particularly prone to infection because of level of this is above ostium level is above in the median stem. That is the reason. Studies carried out established shift period during which children are nil per mouth for sufficient to produce biochemical. The data includes paid measurement of urea and sodium from parents children admission to the induction of expected measurement of sodium urea. The data is normally distributed. What data? This is the paid t-test. The same data has to be measured. Which of the following internal solution contains high concentration of sodium? So it is ringer lactate or sodium chloride. It has to be bicarbonate has got highest sodium chloride. Sodium. 26-year-old woman undergoes resection of terminal ileum secondary to Crohn's disease. Which of the effect is most likely to be seen in the patient post-operatively? So absorption of vitamin D, B12 should go down because of resection of ileum. 19-year-old man is hit on the head with a baseball and he attends to the emergency department. GCS was 15 and then 3 hours later it is dropped to 8 and he develops a fixed dilated pupil on right side. So there has to be right side extradural hemorrhage. Transtentorial herniation is there. So this is what happens, herniation of the medial temporal lobe. This is temporal lobe, or it is called as uncal herniation, heralded by clinical triad of blown. 64-year-old man complains of epigastric pain. He undergoes upper GI endoscopy and special biopsies are taken. Columnar epithelium is seen. containing goblet cells. This is the Barrett's esophagus, and that is called as metaplasia, and it is supposed to be the reversal metaplasia. Barrett's esophagus definition over last 25. Definition has changed over last 25. At least 3 centimeter columnar distal requirement of finding of intestinal metaplasia, intestinal metaplasia without specification. 50 years, Stagan calculus found urine culture, Proteus. Surgeon is preparing patient for the kidney. Which one of the following lie posterior to the kidney? Quadratus lumborum does not lie. This which one of the lie posterior to is psoas quadratus. Psoas is given. So basic is in the center. The central is quadratus lumborum is the major part. Psoas is the medial and transverse abdominis on the lateral side. We finish the incision. If you want to approach, transverse fascia will be the thing. Then to lack of sensation level of umbilical downwards is straightened. Elderly woman is admitted for after the fall. Initial assessment shows that she has core temperature 32. What would be expected physiological response to her body temperature to be? Options are given: regulation of body temperature, increase peripheral vasoconstriction should be first. Otherwise, healthy 45-year-old woman is referred to surgical outpatient clinic with 3-month history of yellowish discharge from the nipple, yellowish green discharge from the nipple, and right breast pain occurs time during at the time which is the most likely diagnosis. So discharge from the nipple, bloody papilloma, ectasia, creamy yellowish, and all these will be ectasia. 75 ml admission hospital to following test results: sodium is less, plasma osmolality is less, and urine osmolality is more. Means this is a antidiuretic hormone. ADH is acting more. So ADH on examination signs of no signs of hypovolemia. Which of the following best explanation? So there is ADH is more, so inappropriate antidiuretic hormone. 14-year boy with sustained laceration to the left knee. During second proliferative phase of healing, predominant cells in the wounds are fibroblasts. Cross-linkage vitamin C has to be required. 23-year-old man presents with recurrent abdominal pain. An episode of rectal bleeding is there. Age is 23. Abdominal pain is there. Bleeding is there. Remnant of vital instructa persistent. Heterotopic. It is gastric and pancreatic mucosa. 79-year-old woman is hemiarthroplastic fracture neck. What would be the feature of resected head? Whether it is osteoclastic, normal bone non-mineralization, diminished bone density, osteoporotic. 35-year-old has open reduction and internal fixation of the forearm, tourniquet after release. Potent vasodilator will be bradykinin or histamine. Okay, histamine is released. Serotonin vasoconstrictor, and all these are. Vitamin K is required. Normal. Which of the following statements true about effective availability of vitamin K? Effect of availability of vitamin K. Warfarin dependent and vitamin K is warfarin is acting, and 1972 1097 are the affect platelet function. So which one of the following is true? Affect platelet function. Affect K dependent clotting factor. Yes. Causes bleeding if takes in excess. Causes bleeding if deficiency. Okay. If there is deficiency, it will be causing. It doesn't cause. Affect vitamin D. It is depleted by broad spectrum antibiotics. If more antibiotics given, vitamin K will be depleted. Also from the fresh blood provides. Vitamin K's absorption is affected by resection of stomach, terminal ileum. It is B12. Young man with shortness of breath. Patient is having breathlessness. Harsh murmur is seen. Left sternal border. Presence of patent ductus. PDA is there. What is most likely the likely effect of this problem? There is shunting of the blood from right. This is patent ductus arteries, the arterial system to venous system. There is pulmonary hypertension. Pulmonary to pulmonary trunk. Yes. This is aorta. This is going to pulmonary trunk. 63-year-old woman complains of crushing chest pain. This is crushing chest pain. Age is 63. Hypertension, hyperlipidemia, heavy smoker. Blood pressure is 140/90. Principal cause of underlying coronary artery blood flow. So coronary principal cause underlying crushing chest pain means maybe myocardial infarction or something like hyperlipidemia, hypertension, or a heavy smoker. Principal cause underlying reduced coronary. So coronary blood flow is decreased because of diastolic time is decreased diastolic interval. That is the reason. Diastolic interval, if it is more, then only there will be coronary blood flow. 40-year-old man complains of sudden severe epigastric pain. This is epigastric signs of peritoneal investigation most sensitive to detecting free intraperitoneal. This is maybe a chest X-ray, but X-ray standing, but CT scan is an ideal investigation. 58-year-old woman presents with 1 centimeter subcutaneous slightly tender lump on the external just below the point of elbow. A biopsy of the lump is carried out. History necrobiotic granulomatous inflammatory. This is necrosis. Which of the following is most likely? So sarcoidosis. Let us see rheumatic nodule. Erythrozyma nodosum. So necrobiotic granuloma is rheumatic nodule. Rheumatic nodule. Differential diagnosis. Necrobiotic example is rheumatic post resection granuloma, vaginous granulomatous granulomas. 47-year-old woman is ventilated and sedated on intensive care unit following head injury. Here there is alkalosis, pH is high, PCO2 has gone very down, PO2 is still more, base has gone down. So there is respiratory, I think ventilated, so hyperventilation is there and base is gone down. So metabolic cancer, compensatory acidosis. What will be the cause of his picture? So there has to be first, there is alkalosis and CO2 is trying to wash out. Because of ventilation, CO2 is washed, so acids respiratory, basically because of hyperventilation in the ICU, alkalosis is there. Bases are coming down, going down to compensate it. 79-year-old man with total hip replacement. He is on insulin dependent diabetes and been long term steroid. His pulse rate is 120, blood pressure is low, capillary filling is 3 seconds, blood urea creatinine are. So here you can see creatinine urea is increased to very high level. Diabetic patient, what is responsible for the blood picture? There is renal insulin dependent diabetic nephropathy is there. So it has to be renal, reduced renal perfusion because of pulse rate, blood pressure is low. So but BP is less. Insulin dependent and in long term steroids. NaCIDs are decreasing. This is NaCID which is decreasing. So QT problem is there. 70-year-old woman undergoes left mastectomy, exit clearance, follow-up appointment. She noted a winging of scapula. This is loss of nerve supply to the serratus anterior, that is long thoracic nerve of Bell. Dehydrated febrile 2-month child is brought to the emergency department with suspected meningitis. Decision to perform lumbar puncture while taking care not to damage conus medullaris. Which vertebral lever is conus medullaris likely to be found in the patient? In child, it is up to L3 level. So L2, L3 is the answer. Conus medullaris L3. In adults, it is shifted up to L1 level. Pregnant 30-year woman has suspected perforated peptic ulcer. Which of the following is appropriate initial treatment? Peptic ulcer is there, and what is the initial treatment? You have to maintain IV fluids, you have to give supplementation. Let us see direct X-ray, no X-ray, CT scan. Initial investigation is not treatment. Right axillary artery is used for arterial canalization. Right axillary artery is used for arterial canalization in order to establish cardiopulmonary bypass in a patient with undergoing surgery for arch of aorta. 8 centimeters is made below the clavicle, extending medial from medial from dectopectoral. Which of the following structure won't be found during dissection? So this is approach for axillary artery. So the joint capsule will not be there, and this is the way axillary lymph nodes. So big incisions taken. Axial lymph nodes are there. Horizontal fibers of pectoralis major is going to be insertion of pectoral. Middle trunk of brachial plexus. They are very far away. Wouldn't be found during dissection. So above the clavicle, that is above the clavicle. Roots, trunks passes lower part of posterior triangle of the neck. Divisions. Cords lie in the axilla. That's why you are going to the axilla. It is above the clavicle. Patient develops hematuria, undergoes cystoscopy, superficial bladder biopsy, pathology reports the biopsy, normal tissue. What type of cells are to be seen? So there is a transitional epithelium of the bladder. Baby born at the term is found to be a unilateral cleft medial maxillary process and medial nasal process. "78-year-old woman presents with ventilatory assisted pneumonia 7 days. Which infective agent Pseudomonas is most common? Let us see. 52-year-old man crashed his motorbike, fracturing one arm. Both the femurs and rupturing spleen require surgery. 20 units blood is given. Blood pressure is 90 and low skin turgor. Biochemistry results are potassium is okay, high little bit. So blood is given. Serum urea is very high. Creatinine is also increased. Sodium is urinary sodium is very less and urinary. So what is the question? Which of the following best describe the kidney response attempt to maintain? So kidney is trying to, whenever there is hypotension, kidney is secreting renin and ADH is trying to conserve the water. So what is the question now? Decrease. This is efferent arterial diameter. Kidney, renin causes efferent vasoconstriction. Afferent is not acting. Renin is acting on the efferent. Decrease glomerular permeability, increase increase glomerular perfusion. They doesn't decrease or increase permeability. It is constant. The only thing is efferent arterial diameter is vasoconstriction is there. A 60 years old woman complains of abdominal discomfort and feeling of nausea 24 hours after undergoing hemicolectomy. On auscultation, bowel sounds are absent and diagnosis of postoperative ileus is made. Increased level of which of the following neurotransmitter response to decrease intestinal motility? Now, intestinal motility is controlled by sympathetic and parasympathetic. Parasympathetic causes mobility and sympathetic causes. So increased level of which of the following neurotransmitter responsible decrease? So acetylcholine, if suppose this is decrease. Now what is that? Abdominal is failing. On auscultation, bowels are absent. Okay. Paralytic post-operative ileus is there. Increased level of which one of the following neuron is responsible for decrease? So acetylcholine is going to cause motility and sympathetic is going to cause decrease the motility. So here this thing you have to understand. Mechanics, no. What is there? Surgical insult, gut manipulation, intra-abdominal pressure increases. That causes sympathetic pain, sympathetic causes stimulation, nausea, vomiting, opioid analgesic, all they cause sympathetic stimulation. Human like brain, neurons and ganglia. Inflammation, inflammatory mediators. All the sympathetic stimulation, they causes paralytic ileus. So paralysis. Parasympathetic release, sympathetic stop. S is stop, para is R is release. So motility will be increased with parasympathetic, vagal stimulation with increased parasympathetic, diarrhea, and sympathetic stimulation will cause stopping of this. 40-year-old man present with flushing, diarrhea, abdominal cramps, dizziness, 25 indolence. This is neuroendocrine tumors, or what is they call as disseminated neoplasia. Which tumor most likely to be there? Small carcinoid tumors. So neuroendocrine tumor cells. 5-hydroxyindole acetic acid, 5H indole acetic acid, 5HT, 500 other bioactive substances in liver. Symptom flushing, diarrhea. So liver secondaries are there, then it causes appearance of 5 indole amino acids. Lactic acid cycle, Curie cycle is important in lactate metabolism in septic surgical patient. Which one relies on the septic cycle? Erythrocytes basically depend on, and hepatocytes work on the opposite of the Curie cycle. So in muscles, this is the Curie cycle. What happens? The glucose is converted to pyruvate and to lactate in muscle whenever there is anaerobic, while this lactate is converted back to glucose in liver. But this anaerobic metabolism or aerobic metabolism, this requires mitochondria, and RBC doesn't have mitochondria. That's why we totally depend on the Curie cycle. You can see this glycolysis dependent skeletal muscle blood cells. Here what happens? Glucose is converted to lactate and pyruvate. Glycolysis dependent tissues, skeletal muscle, blood cells, bone marrow, medulla, periphery, hypoxic tissues. This is anaerobic metabolism on right side. Then this lactate is converted back to glucose in the liver. 60-year-old man is admitted after suffering 10% full thickness burn to the chest and debrided. A split skin graft is applied after 2 days. After 5 days, he has pyrexia, complaint of increasing pain, excessive seepage through the dressing. Which of the most appropriate empirical antibiotic? So 5 days seepage breathing, pseudomonas infection is there. Antibiotic required will be against cephalosporin, metronidazole. Streptococcus pyogenes. Okay, here is pyogenes. If it is green color. Metronidazole and penicillin. Treatment is penicillin, drug of choice for streptococcal. 40-year-old woman undergoes a biopsy of breast lump. Which one of the following changes in the report might imply significant increased risk of development of malignancy? Now you have come with the report, and what will be the increased risk of malignancy? Atypical ductal hyperplasia. Atypical, whenever there is atypical, ectasia, fibroadenoma, intraductal, nothing. Whenever atypical, this word is there, that is increasing malignancy. Hyperplasia, mild dysplasia, moderate dysplasia, carcinoma, invasive carcinoma, high duct. Atypical ductal hyperplasia. Blood pressure data collected in emergency department is used when studying blood pressure levels after trauma. Which of the following statistical data types is most appropriate? So continuous, now how is this? Variable, qualitative, quantitative, nominal, ordinal, or it is also called as categorical. Qualitative is categorical and quantitative measurement is in. So category is nominal, not ordered. Ordinal, ordered. Degree, severity, and all these gender disorders. Discrete count. So here it is continuous. Quantitative measurement, continuous real values are there. You can. 75-year-old man presents with dysphagia, neck swelling and regurgitation. There is difficulty in swallowing, neck swelling, regurgitation, variant swallow, presence of pharyngeal diverticulum. This is usually cited as inferior constrictor, cricopharynx and the thyropharynx. 62-year-old man presents to the general practitioner with a pain in the knees, and on examination there is 6 cm percentage mass in upper abdominal. CT scan shows an abdominal aortic aneurysm starting distal to the origin of renal arteries and ending just above the bifurcation. What is most likely cause of aneurysm? Medial necrosis. So here is atherosclerosis. The option is not medial necrosis, cystic medial necrosis. So what is there? Marfan's. Why? Marfan's is not there. Polyethylene node is there. Distal to the origin of renal arteries, just above the bifurcation of aorta. This question is doubtful. Marfans has to be there. Now, 60-year-old man, woman presents with short history of intermittent diarrhea, flushing, and wheeze. 6 years ago, she underwent right hemorrhage for cecal carcinoma. Admission was this much normal, less than. Now, which of the following can be used to control octetride carcinoid syndrome? Elderly man sustained perforated antipeptic patient. Where would you like fluid collect? Supine position, hepatrenal pouch. 36-year man injured his left hand with a knife, suffering a deep puncture wound to the palm. Examination is unable to flex the distal interphalangeal joint of middle finger. It is FDS, FDP, not superficially. It is profundus. If it is for thumb, flexor digitorum, flexor pollicis longus for thumb. 30 years old is admitted to the hospital of osteomyelitis of tibia. What is the most likely organisms? Osteomyelitis, commonest organism is Staphylococcus aureus. It is blood spread. 56-year-old man with recent onset of pancreatitis fits neurological examination, muscle weakness, hyper ECG. This is increase calcium leading to hyperexcitation, hyperreflexia. Acute interval will be prolonged. Demonstrate muscle weakness, and ECG shows prolonged acute interval and TVO inversion. Which of the following laboratory finding is most likely to explain clinical acute pancreatitis? There has to be hypocalcemia. Okay, decreased. A surgeon is carrying out repair of inguinal hernia. He incises the skin superficial, depends the incision down to the fiber external oblique. He opens the layer and fiber exposes spontaneous. A nerve which is coming anteriorly is the inguinal nerve, deeply is the genital branch, genitofemoral nerve. So next question is 50-year-old male presents with the difficulty in swallowing, alteration in his voice. On examination, there is vocal cord paralysis and absence gag reflex. There is weakness of the trapezius and sternomastoid muscle. A cranial MRI reveals mass lesion in skull base. The mass is likely to involve. These are what is there? Glossopharyngeal vagus, jugular foramen. So vocal cord paralysis. Okay, which 10th? This is about the 10th nerve, vagus nerve, and along with this, there is deglutition. There is also examination. Basically, it is vagus nerve. It's passing from the jugular foramina or these important nerves. 34-year-old man is seen in image dependent fibular fracture. Examination noted to a loss of ankle dorsiflexion. Plantar is S1, dorsi is L4. Which area of the skin should be examined to confirm loss of cutaneous distribution of the nerve? So L4 it will be the below the knee joint. L4. Let us see first. Okay, common peroneal. So L5, deep peroneal. This is the space dorsal. This is the question again and again asked. Common peroneal divides into recurrent articular branches from just anterior. Deep peroneal is anterior, super is lateral and posterior. Deep peroneal is supplying to the first sensory branch for the deep peroneal. So dorsiflexion is from the deep peroneal and superficial peroneal is the so common peroneal is just below the knee, superficial peroneal is the lateral part, and deep peroneal is the first wave. This is important. This is lateral part of the leg that is totally by superficial peroneal, and it is only supplying to the peroneus longus and peroneus brevis, which is passing from behind the lateral malleolus and causing eversions. Eversion. This is for the eversion of the foot. And inversion as well as dorsiflexion is by the deep peroneal, and deep peroneal is going to supply first wave, and common peroneal is total dorsiflexion and total. This is the common peroneal. 55-year-old presents with vomitings, weight loss. Upper GI endoscopy reveals pyloric stones here. Which of the vertebral level transport L1? 58-year-old woman present with numbness in the median nerve distribution of her right hand. Nerve conduction studies compression of the median nerve at the carpal tunnel. Which of the following intrinsic muscle hand is least likely to be wasted? Now, wasting in this is, if it is abductor pollicis or lumbricals or whatever, let us see. Yes, dorsal adductor, abductor pollicis is gone. First lumbrical, flexor pollicis brevis, opponent's pollicis. Thumb muscles are all these supplied by the median nerve, except adductor pollicis, which is not given here. And dorsal interstia and palmar interstia by the ulnar nerve. So branches in the hand. This is like this. This 29-year man suffered an injury and it divides the spinal cord between the lumbar and sacral segments and divides the adjacent lumbar nerve. Which one of the following group of muscle is most likely at the risk of forming contractions? Suffered the injury that divides spinal cord between lumbar and sacral segments. So L5 and S1. Adjacent L5 S1. Adjacent lumbar nerve roots. So it is femoral. Let us see what is that they are telling now. Plantar flexors of the ankle. Adductors of the hip, extensor, this is obturator, extensor. Which one of the following group of muscle is most risk at forming contraction? It is exactly at this level, plantar, upper motor neuron, lower motor neuron lesion, plantar flexus of the ankle. This is S1 root. So plantar flexus. Ankle jerk is S1. That's why they are telling about plantar flexus. Following endovascular repair of aortic aneurysm, MRI angiogram, complete occlusion of inferior mesenteric artery. But he has no symptoms. So there is additional marginal drawn from the middle colic artery, which is a branch of superior mesenteric artery. Elderly woman, severe neck arthritis is there. Severe neck arthritis. You note she has some loss of sensation over her thumb and lateral forearm. Thumb is 8. For example, lateral forearm C5, C6, C7. C7, C6 and C7. It has to be C7 or C6. Thumb is C6. Index is 7 and little is 8. This is important. No? C6. 70 during routine is found to have potassium is high. Abnormal is thought to be due to inhibition of sodium potassium exchange pump in the collecting ducts. Aldosterone is acting here. ADH, potassium sparing agent. So this is the figure where which drug is acting. Carbonic anhydrase is proximal columnar tubule, a loop of Henle, ascending loop is loop to diuretics, furosemide and all that. Thiazide diuretics at the descending and potassium sparing at the collecting duct through ADH. 33-year-old woman with long-standing rheumatoid arthritis admitted with perianal abscess. Investigation revealed chronic renal failure thought to be due to amyloidosis. Which of the following subtype are likely to affecting the kidneys? Which type of A protein? Amyloidosis, kidney A. Primary AL amyloidosis deposition, secondary AA. Associated with chronic inflammation, primary is 34-year-old woman with systemic sclerosis develops swollen legs, ultrasound scans, deep iliofemoral deep vein thrombosis, iliofemoral DVT. She is commenced on warfarin. What should be INR ratio maintained at? It is to be 2:4, 2:3 is given. So 2:3 is okay. 2:3. Surgery for provoked DVT, 3 months. We are not going to go. 35-year-old man presents with severe colicky pain as a result of calculus on his right ureter. Pain radiates into groin. Referred pain is also most likely to which of the following nerve roots? So the referred pain of the this is Lumbricus is T10 and loin to groin L1, L2. Let us see what is L1, L2, T2, L2, L2. So renal colic, strong peristaltic waves of contractions, ureter. There is a renal pelvis, ureter, and their afferent nerves into spinal cord through T12, L2, L1, L2 is the basic. So that's why the colic is at T12, L2. Temporary porcine graft. This is a xenograft. Malnourished 3-year-old child was feature of kwashiorkor with hepatosplenomegaly. Malnourished kwashiorkor, hepatosplenomegaly, accumulation of which is deficiency of vitamin. It's fat accumulation. Inadequate response to adrenal cortex, plasmin, hypoalbuminemia, edema, fatty infiltration. 77-year man presents with non-tender swelling in the left groin, positive cough impulse, direct inguinal hernia present, cremastic muscle is derived from external oblique, internal oblique, transverse abdominis. So this is internal oblique muscle. So these are very important. Skin is continued as the skin. Abdominal wall, here is the dartos muscle, there it was carpus, and other is the that is carpus fascia, and subcutaneous skin was campus. So carpus is continuous as dartos, external oblique muscle into external spermatic fascia, internal oblique into cremastic muscle, and fascia of internal oblique into cremastic fascia. Internal spermatic from transversalis fascia. Tunica is from the peritoneum, parietal and visceral layer. Which of the following statements are true for sinoatrial node? It is pacemaker, it is supplying blood supply, nerve supply from the vagus nerve. Uh, 10-year-old boy, 10 image dependent falling from the bike has pain and swelling in supracondylar humerus. This numbness over the tips of index and middle finger. Weakness of flexion of the same fingers. Plain X-ray displays supracondylar fracture. Is this AIN or median nerve? AIN is not given, so median nerve is there. So this is supracondylar fracture, median nerve most commonly injured. 65-year-old man has a hip replacement done. Anterolateral approach, postoperative noted waddling gait. So gluteus medius loss, superior gluteal nerve. Patient is being considered renal transplant. Long-term success will depend on immune suppression. Apart from ABO, TP, DUR, R is there. DR, HLA, DR. Patient 24 hours painful perineal swelling examined under general anesthesia. On examination, hysterectomy is found surrounding necrotic skin. Which of the following most likely? This is polymicrobial causing necrotic fasciitis mixed. That is mixed aerobic and anaerobic. That is polymicrobial. Diabetes, if it is there, then it is polymicrobial. Monomicrobial is fungal. 60-year-old man presents with constant upper abdominal radiating to back, substantial weight loss. What is the here? Abdominal pains, radiating back, anorexia. So this is constant abdominal pain. Endoscopy can be there, CT scan can be there. Options, CT scan. 40-year-old woman has anterior lobe enlargement because of tumor without hormone replacement. Which of the following could occur? Hyper, okay. Now anterior pituitary lobe removed. So the growth hormone TSH will decrease, so hypothyroidism will be there. 92-year-old woman who has 2 children present with 4-month history of pruritus ani attributed to hemorrhoids, adhesive tape. This is most appropriate antimicrobial agent, metronidazole, albendazole. This is 85 again. MRI scan of 72-year-old man cervical spine shows degenerative spondylosis, the encroachment of the osteophytes in the spinal canal. This is visible myelopathy, compression of thick and spine.
Cervical spine shows degenerative spondylosis and encroachment of ossified spinal canal. Which of the following clinical picture will cause prolapse? What is this? Weakness limbs, central disc prolapse, central cord, spinal cord compression. Passes mucinum per vagina. Newborn girl passes the vagina first 24 hours. Exemption anesthetic the fistula to the posterior vaginal wall. The most likely to be due to development anemia is the cloaca, imperforate cloacal vaginal septum. This is 37-year-old insulin-dependent diabetes woman admitted to coma with respiratory rates, 3 plus glucose, presence of ketones, breathing air. What is most common? Blood gas results. So Cosmos breathing is there. The diabetic ketoacidosis has to be there. So O2 saturation is there. PO2, pH is less. Carbon dioxide is very less. 35-year primary and ultrasound polyhydramnios. Baby is more difficult in breathing excess fluid from the mouth. Which of the following signs indicates prenatal tracheoesophageal fistula? So thank you. This is about around 100 questions.